And welcome to the Dr. Bob Show. Have you ever wondered about what would happen if your heart just started not working as good? If it got a little bit weaker and it didn't function as well as it should? That can happen. And when that happens, we can call that heart failure, when the heart really doesn't pump well enough. What are the symptoms of that? How do you know if you have heart failure? If you've got chest pain or chest discomfort, is that heart failure? What do you do about it? What's the prognosis? How long are you going to live if you have heart failure? Boy, do we have a lot of answers, and great answers for you. My guest is Dr. Josh Todd. Dr. Todd is a board-certified cardiologist, heart specialist. He'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about our old friend, obesity, and how obesity is connected with other diseases like cancer, like heart disease, like kidney disease, and what we can do about obesity. What's the key to it? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Josh Todd, board-certified cardiologist, and we're talking about what happens when the heart really just begins not to work as well. Josh, welcome to the Dr. Bob Show.
Thanks again for having me, Dr. Bob.
So tell me, when the heart doesn't beat as good, can it fail, and what does heart failure mean?
Yeah, heart failure, if you go Google heart failure, you're going to see the heart doesn't pump well. It's a little more complicated than that. I kind of more like to think of it as that the heart doesn't handle fluid or volume very well. It can't get it out of the heart, and it has problems getting fluid into the heart, so it can back up into a lot of different organs, the lungs and the feet and the belly, and also can't get it out to vital organs like brain and kidney. And
so in general, what happens if the heart can't beat out, if it's just not strong enough to throw that blood out to the rest of the body? What happens to the body?
Yeah, again, I think you have to look at the two functions that the heart does. The heart is responsible for moving blood and oxygen around to all your cells. Once it delivers those cells oxygen, it ends up on the veins or the venous side of the body. That fluid can pool, especially when it's not moved out quick enough. So that aspect of it, people can get swollen feet. That fluid can build up in their abdomen, and we can get swollen abdomens, and it can end up in the lungs as kind of last resort and end up with breathing issues.
When it backs up into the lungs, is that fluid that's in the lungs?
Yeah, generally what happens, again, the lungs are like a sponge, and if you put it under high pressure, the lungs tend to absorb water. And so yes, the ability of your body to filter in oxygen through a wet sponge doesn't work very well.
So if we get it in the legs, what do the legs feel like? What's it like if they fill up with water?
Yeah, the legs, my biggest concern with edema or lower extremity swelling that can happen, if they get too much fluid, we can start having non-healing wounds, which can be a problem. You can't get enough blood flow into the legs because of the pressure. There's cosmetic and aesthetic reasons why people don't like their legs swollen. And we can certainly get into infectious issues with that too, in terms of skin disorders.
You said the abdomen can swell. What do you have a name for that? My belly swells sometimes when I eat too much food.
Yeah, we start to get some what's called ascites, and historically we've used that term only with patients with bad liver disease. But the heart, again, is kind of the central organ, and everything can back up.
So everything backs up because the heart's not working efficiently.
Correct.
Well, what are some of the causes or what are some of the symptoms that people have?
Yeah, most of the symptoms I get, again, are swelling in the feet. I am short of breath. A pretty specific diagnosis is I lie flat and I can't breathe and have to wake up at night. We call that orthopnea. If you're having to sleep upright in a recliner, that's a lot of times late stage or heart failure where we're having a lot of volume issues. So lying flat, gravity is not good, heart can't can't move it around. And if you have problems with that, then heart failure is usually one of the top on my list of diagnoses.
Are there some illnesses that make the heart where it doesn't efficiently pump out or it can't collect the blood?
Yeah, there's a whole list of reasons why the heart cannot pump well. Most commonly in this area is due to heart artery blockages or coronary artery disease.
So if there's coronary artery disease, that supplies the heart muscle. What happens? Why does the heart muscle need that blood supply?
Yeah, again, it's like a sprinkler system in the summer. So your heart is probably the most active organ in the entire body. It needs oxygen all the time, and if you can't give it oxygen and blood or water, as you want to liken it,
it gets weak.
It gets weak, and you can have it die. You can have it be stunned, and so there's varying degrees of heart failure in terms of what's going to happen to you long term.
Coronary artery disease. What other illnesses might keep the heart from beating efficiently?
There's several viruses that can attack the heart, and we call that a viral cardiomyopathy.
Cardiomyopathy, and that sounds like a medical word.
It is, yeah. All you take cardio just means heart, and myopathy means bad, so all it means is bad heart.
And the muscle gets real weak and just not efficient. Another cause?
Yeah, another cause can be some genetic reasons. So you can hold on to too much iron. There's something called hemochromatosis. There are some autoimmune diseases like amyloid and sarcoidosis that can do that as well.
So it really gets to be a sophisticated number. Can a heart valve make it where the heart weakens?
It can. The heart pumping against a aortic valve that is stiff and narrow. The aortic valve is the valve that allows blood to escape out of your heart. And so if the heart muscle over a long period of time has to pump against a valve that won't open, it can weaken. Also, if you have a very leaky valve and it's pumping the wrong direction over a period of time, the heart can weaken too.
So we've got coronary artery disease, we've got a myopathy, we've got valvular heart disease. There's a whole bunch of things that you have to be aware of. When there's fluid in the lungs, what's it sound like to you?
So we get crackles or rowels are the terms we use, but it sounds like kind of tissue paper being crumpled up. And really it's not fluid. What it is the lung expanding, all the tiny little air sacs when you take a deep breath. And that can happen just from sitting down, and sometimes you can have rowels by not taking enough deep breaths, and a lot of times it's fluid surrounding the lungs, squishing it.
How does the patient usually end up getting to the heart doctor if they've got these symptoms and they may not know they have coronary artery disease or valvular heart disease? How do they end up at the cardiologist's office?
Right. Usually they either come in really late and they're sick and they end up through the emergency department. And in that case, it's, we're worried about treating the heart failure first, making them better, and then at the same time kind of work on the diagnosis. On an outpatient basis, when people usually come through their primary care doctors, usually I've noticed a little swelling. The primary care doctor may hear a murmur on exam that may trigger it. And then if the primary care doctor orders an ultrasound of the heart, sometimes that kind of gives us an idea initially coming in to see us.
So are there tests to make the diagnosis?
Yeah, heart failure again is a clinical diagnosis, meaning that you have to base it on symptoms. You can have a bad-looking heart on an ultrasound and not have heart failure, and vice versa. Yes, it's diagnosed by a constellation of what you look like on exam, your symptoms, and then yes, we have lots of testing for it as well.
Give me a test.
Test is the gold standard is probably an echocardiogram or an ultrasound of the heart.
Echocardiogram, that's an ultrasound sort of thing of the heart?
Just like for babies.
And does it tell you how efficiently the heart is beating, whether it's sort of failing away?
It does. We have something we call an ejection fraction. And what that is the amount of blood that comes into your heart, the amount that's supposed to get pumped out. Most people pump out about half the amount of volume that comes into their heart.
And if is there a number that you say your heart's not doing well? Is there a number we need to keep in our head? Yeah,
anything less than 50% is abnormal, really abnormal, where we talk, really sick heart, that number of 35% or lower is really sick.
35 to 50 is
is the moderate. We need to get hold 35% and below is a really
That's
sick heart.
ejection fraction that you find with an echocardiogram. What's the BNP?
BNP is a lab test that is, it's kind of become in vogue, but really what it is it kind of measures heart stretching, or the top chambers of the heart that get stretched. That can happen in heart failure. That can happen in probably 20 other conditions as well. So, you know, personally, I think of it like a D-dimer, or, you know, the only good BNP is a normal BNP.
Yeah.
So I don't use it for the diagnosis of heart failure as much as I do treatment and excluding heart failure.
What's the electrocardiogram and a chest x-ray tell you about somebody, whether or not they have heart failure?
The electrocardiogram gives me an idea, and it's a screening test of, have you had an old heart attack? Do you have any bad electrical conduction systems? The chest x-ray can tell me size of the heart relative to the chest, and it can tell me, do you have fluid in the lungs?
So the chest x-ray is important, echocardiogram is important. A bad BNP may help lead you toward there.
Correct.
How about the treatment of heart failure? Is it better than it used to be? Is there a standard treatment? Is there anything we can do when the heart ejection fraction is low?
Yeah, first thing again is to figure out why the ejection fraction is low. If it's the first reason, meaning plumbing issues, we fix the plumbing issues. And then we put you on medications, which we'll talk about. If it's a non-plumbing related issue, then it's medications, and that's all we've got to improve the heart function.
So there is good medicine, there is treatment that we can improve the prognosis.
Correct.
That's what we're going to be talking about when we come back. What is the treatment if your heart's not failing? You know, there's lots of great treatment, so it's not a doom and gloom diagnosis, but it sure is time to wake up. You want to stay tuned. We'll talk about what's the treatment of congestive heart failure. We're talking with Dr. Josh Todd, and we're talking about when the heart really doesn't work efficiently, it begins to fail. We talk about heart failure where fluid accumulates in the lungs, in the belly, in the feet, and we've got shortness of breath and we can't lay down flat, and there's several causes, and now we're getting into the treatment. Because that's what's important to you and me. Is there treatment available for somebody that's having heart failure? When you see a patient in your office and you know that they've got early heart failure, what's the treatment?
So medical treatment of heart failure needs to start first with two medicines that are kind of the basics. We start with something called a beta blocker. Beta blockers slow down the heart rate, make the workload of the heart much less.
It's almost everybody that's in heart failure, you need a beta blocker.
Beta blocker. And there are two specific beta blockers most people use, something called carvedilol and metoprolol. Those are the two ones that are have a little bit more data behind them for heart failure in particular. There's
So beta blocker.
Beta blockers, and then there's a group called ACE inhibitors, or ARBs, or ARBs. They do basically the same thing.
Do you use those together?
We do, yeah, but both of them need to be on. And the thing you need to realize about ACE inhibitors and ARBs is we can't just put you on a teeny tiny dose and then let you take it for a year. Your heart's not going to get any better with that. So once you get put on these medicines, it's a visit to the heart doctor every couple weeks or every month to go up on these medicines. We have target dosing we need to get you to so that your heart will improve in function. And that's how we get people better. It's put on baby doses, and every 2 to 4 weeks you're coming to see us.
So when you come to see the doctor every 2 to 4 weeks, what are you looking for? Do you have to get another echocardiogram to see if the heart is functioning better, or you see if there's less fluid in the leg? We look at them clinically. So are they having improvement in the swelling of their feet? Are they having improved exercise capacity? We generally won't get an echocardiogram immediately. We wait 3 to 6 months. And we need those medicines to marinate the heart muscle. It is not going to get better overnight. So that's really important that we start titrating up the medicines, or going up on the doses of the medicines, and then look at 3 to 6 months in terms of improvement. So it takes really very careful adjustment of medication, and there are some more medicines. We'll get into those. How about lifestyle? Can the people be active What about their diet? What about salt?
Yeah, salt's pretty important, especially in somebody with a really low ejection fraction or a really weak heart. The body, when it's in heart failure, almost thinks that you're losing blood, and so the kidneys love to hold on to salt and water because they think you're bleeding out. So it's there to maintain blood pressure. In the short term, it's fine if you need to go catch a bear for food or do something like that. Long term, it causes worsening heart failure. So we try to reverse that, and then also salt intake. So we try to stick them to a 2,000 milligram a day sodium diet, and sometimes even less.
2,000 milligrams.
2,000, yeah.
Would that be called a low salt diet?
Low sodium diet,
It
yes.
just means you never salt the food with a salt shaker.
No, and more importantly, people don't salt foods. It's eating out, restaurants, and reading labels.
Yeah.
And that's the hidden salt that people don't realize.
So salt, like Morton's salt, is iodized salt. Sodium, that's the bad one. Are there potassium salts? Is there a reason to use other salts?
There are, but it's still the body holds on to potassium. It can exchange the chloride and the sodium, so there's probably not that much different in terms of volume related to heart failure. There's no guideline recommending potassium salt. And a lot of times kidney failure can accompany heart failure as well, and people run into potassium issues when we start
People
talking.
do a good job of going on a low salt diet. Do they cheat much? Or their heart failure makes it where I better follow what the doctor does?
It is. We give a medication called Lasix, or a water pill, to help with symptoms. I more use that with patients and tell them it's their get out of jail for making a bad salt decision. And so I will normally put them on a daily dose, and then based on what their salt intake may be, they do daily weights. And if they increase their weight by more than 3 or 4 pounds in a day, that's not fat, that's fluid, take some extra Lasix. And how Lasix works is it just gets the extra salt out of the body and water follows. So patients can have some control based on their sodium intake, and it's those patients who are pretty good at figuring out how much Lasix they need that stay out of the hospital and do well with things too.
Do you have people weigh daily? Because it's important if they suddenly gain 3 pounds, you know something's going on.
It is. Daily weights are very important with patients. So I tell them day one, get a scale, and we need to watch and what's your dry weight, and you need to know that.
So we've got low salt diet, we've got diuretics, we've got beta blocker, we've got an ACE inhibitor and an ARB, an ACE receptor blocker. Other medicine, we're getting into a lot of medicines.
We are,
How about aldosterone sort of
Yeah,
stuff?
spironolactone or aldactone is certainly helpful too. Again, it works by blocking the kidney's ability to hold on to salt.
Is that part of the treatment of failure?
Part of the treatment of failure, certainly in patients with low ejection fractions, less than 40%. That should be in addition to the beta blocker and ACE inhibitor. Part of the mainstay or the food groups they need to be on.
So how do patients do? You know, you've got these medicines that are really good. They all effectively help the patient. Does the patient suddenly begin to improve their well-being, less fluid, feel better?
Yeah, unlike, say, a heart attack where we can fix you within 15 minutes, these type of heart symptoms do take a little while to get better. The Lasix is there to help with the fluid and the volume related issues. And yes, they do get better, but it's a 3 to 6 month process of going up on the medicines, being compliant with the medicines, taking them as prescribed, being compliant with a low salt diet, and slowly, and the good thing is Medicare has approved cardiac rehab for heart failure patients now.
So there's a rehab for failure.
There's a rehab for heart failure
Rehab
now.
Rehab to me means you go to the gym and exercise under guidance.
Yes.
What is it?
Same thing. It's you go there. We have some exercise physiologists, nutritionists that give them dietary information, go over medication, ensure medication compliance. Then they set an exercise prescription and get you moving around. So it's a slow, progressive incline, and they watch them on a heart monitor to make sure we don't have any rhythm disturbances while doing it.
That's absolutely fabulous. Does it get to be a club of people that are coming for rehab, and they come and they enjoy, I'm doing better than you're doing, or what's it like in rehab?
Yeah, again, everybody there has a very similar medical condition, obviously. There's a community with it. Obviously, there's depression associated with heart disease and having heart failure and any chronic diagnosis, so it certainly helps with the depression aspects of things. That's kind of, again, mainstay in addition to medications is, can I get you to rehab to at least go 3 days a week?
When you make the diagnosis, and when you put the patient on medication, and when they're doing a little bit better and they're able to go to rehab, What do you tell the patient their prognosis is?
Part of it depends on what the reason is. If they have heart artery blockages and they've sustained a lot of heart attacks and it's dead heart muscle,
Sure.
Prognosis is not quite as good in terms of making that number look better. In terms of viral cardiomyopathies, meaning that it's a virus that attacks the heart, those patients usually do really well. The big I don't know box, we haven't found a reason, we're going to put you on medicines. It usually follows the rule of a third, so that a third will have minimal improvement in their heart function, a third will get better but not quite back to normal, and a third will get completely back to normal. So,
isn't it great to take a patient with heart failure and watch them improve and guide them and have them come back to you and say, Doc, I couldn't have made it without you.
Yeah, the happiest time is when I see them every 2 weeks going up on these medicines, and for me to tell them it's 6 months or a year now from when I have to see you, that makes them happy.
It'd be wonderful to be a cardiologist. I want to thank you for coming to the Dr. Bob Show to tell us about heart failure and tell us it's not necessarily doom and gloom, but it sure is something that you really need to pay attention and see your doctor.
Thanks again.
A lot of information. I hope that if you have symptoms of a failing heart, that you make sure that you treat it properly. And now we're going to want to stay tuned. We're going to be talking about our old friend or enemy, obesity, and what other illnesses does it cause, and what can we do about obesity? A lot of information left. You want to stay tuned. I want to thank Dr. Josh Todd. Wonderful discussion of when that heart just doesn't beat as strong as it should. Thanks, Dr. Todd. Now, questions from you, the viewer, that I think will be important to your health. Dr. Bob, is obesity really bad for people? They sit around, don't do much. How bad is it? Well, obesity is probably the new smoker. We know that smoking causes everything. Well, now it's obesity that seems to be the thing that's related to a lot of illnesses. Let's talk about it. Obesity is associated with various different types of cancer. It's an increased risk factor for breast cancer, for colon cancer, for esophageal cancer, for several cancers in the body, just because we're overweight. So if we can keep from getting overweight, then our chances are less of having cancer. How about type 2 diabetes? When we're overweight, when we have obesity, then the insulin that works on keeping our blood sugar down doesn't work as well. Just because of obesity, we get insulin resistance, major cause of snoring and obstructive sleep apnea, where people stop breathing during the middle of the night. And when that happens, when people don't breathe for a period of time, the adrenal gland says, wake up. The brain says, wake up. And we get high blood pressure and we get heart rhythm problems in the middle of the night because of snoring and obstructive sleep apnea. There's kidney disease that goes along with type 2 diabetes, and so we can get kidney failure because of obesity, which causes the diabetes. We can get hypertension. We get high blood pressure just because we're overweight. When we do bariatric surgery on somebody that's hugely overweight, with the bariatric surgery, they'll lose their type 2 diabetes, they'll lose their high blood pressure, they'll lose the risk factors to get cancer. And so we've got to be able to take obesity and do something about it. So what can we do? There's always a diet of the year that I get around to. Recently it's been a Keto Diet. That's the old Atkins diet, a little offshoot on that. But that's high meat, high fat. That's exactly what we don't want. It makes the body burn fat, though, if you don't have carbohydrates, if you have very low carbohydrates. And so there's reasons why you will lose weight. Yeah, you'll lose weight. But most often people don't continue on that type diet, and they go off that diet. When they do, they yo-yo back up. And so their weight sometimes is worse than it was before. So I'm not in favor of the keto diet. We know that a plant-based diet. Now, what does that mean? That means that we eat vegetables, leafy vegetables, beans. It's the vegetarian diet. That's the diet that really people do well. If you Google the Mediterranean diet, it's more fruits, it's more fiber, it's the things that we need. And I've got an old statement. My son and I were going to write a book, How to Lose Weight. It's eat less and exercise more. You've got to be able to exercise, and people can exercise at all ages. As you get older, it may be swimming, it may be water aerobics. If you're younger, it may be more intense exercise. And when you're young, we need to get outside and be active more. The American Heart Association says we need to be exercising 30 minutes 5 days a week. That's 150 minutes a week. It's not that hard to exercise for 30 straight minutes. If you do that and you eat properly, Weight Watchers, very, very effective. They've got apps now that you can use with that. But I say Google the Mediterranean diet. Get a partner where you meet together, or a group. Get a club that gets together, all people your age that will be able to exercise and learn how to eat properly. You'll stay healthier. And now, what do we say in the Dr. Bob Show at the end of every show? It's exercise. Be sure that we exercise that 30 minutes 5 times a week. It's not that hard. Get your tennis shoes out. Have fun exercising. You'll feel better. You'll have a runner high. It'll take care of anxiety. You'll just feel better. 7.5 hours of sleep. Wow, how do I do that? It's pretty easy. Know what time you're going to wake up, and 7.5 hours before that, you need to go to bed. You need to sleep well. You need to know how to sleep. And if you're having difficulty, then you need to talk it over with your doctor. Eat properly, a diet of fruits and vegetables, Mediterranean diet. And most of all, what is it we like in the Dr. Bob Show? It's that laughter in your life. People that laugh and are happy, their immune system works better. They have less infections. They feel better. They do better. People around them do better. So don't forget, if you have laughter in your life, if you laugh a lot, you will stay healthy.